Good afternoon, Dennis Taylor. My name is Mihiraa. Let's start the warm-up session. Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
Discuss the personal attributes that make you especially qualified as a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I am also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
How will you make a positive impact on the nursing profession?
There are different ways to contribute to making a positive impact on the nursing profession. Creating feedback forms as forms helps us secure and promote our jobs and give us the motivation to work hard. Nurses deserve better working standards and benefits for their hard work. Therefore, listen carefully to what nurses have to say to light down the workload. Additionally, provides continuing education for all to make us stay updated to be the best always.
Your preparation time is over. You can now start your role play.
Hello Mihiraa, it's good to see you today. I am here to discuss your discharge care. How are you feeling? I can see you are a bit worried. I understand it's a lot to take in, especially with your upcoming discharge. Let's talk through everything, and I'll do my best to help ease your concerns. So feel free to share what's on your mind.
I'm feeling better physically, but I'm worried about what happens after I leave the hospital. There's just so much to think about and I'm not sure how I'll manage.
I completely understand Mihiraa. It's natural to feel a bit overwhelmed, especially after something as significant as a stroke. Let me reassure you, I'm here to walk you through the steps we'll take to ensure you're well supported after your discharge in 2 days. Now, before we dive into the details, are there any specific challenges you anticipate facing after you go home?
Yes, actually. I'm worried about a few things. I'm scared I won't be able to handle things on my own. Well, Dennis, I'm just worried about how I'll manage everything, like getting dressed or even just moving around. I still feel weak on my left side, and I don't know if I'll be able to take care of myself. I don't want to be a burden on my family.
I completely understand your concerns Mihiraa, and you're absolutely right to think about these things. After a stroke, it can take time to regain full independence, but that's exactly why we have a great team in place to help you during this period. After you leave the hospital, you'll have access to various support services, including occupational therapy, speech therapy, a community nurse, and your general practitioner. You won't be left to manage alone Mihiraa. First of all, you will have access to an occupational therapist. Their role is to work closely with you to regain as much independence as possible. They will assess your needs and might suggest adaptive equipment to make daily activities like getting dressed or preparing meals easier. They can also show you exercises to help build your strength and coordination gradually. The goal is to help you do these tasks on your own, step by step. For any communication or swallowing difficulties you might experience, a speech therapist will also be there to support you. They'll guide you through exercises to help improve your speech, language skills, and swallowing, which can sometimes be affected after a stroke. These therapies are tailored to your individual needs, and the therapists will work at a pace that suits you.
But how long will it take for me to start seeing real progress? I don't want to be stuck like this forever.
It's understandable to want to know how long recovery might take, but it's important to remember that progress can vary from person to person Mihiraa. While we can't predict an exact time frame, the key thing to keep in mind is that recovery is often gradual. Small steps forward, over time, can lead to significant improvements. It might not happen overnight, but with consistent effort and the support of your therapy team, you will notice positive changes. I know that rehabilitation can be a long process, but it's incredibly important for your recovery. Consistent therapy can make a significant difference in improving your communication skills, functional abilities, and overall quality of life. With regular practice and support, you can regain your independence and enjoy a more fulfilling life. Remember, every step forward, no matter how small, is a victory, and with time and dedication, you can achieve great things.
I see. It sounds like there's a lot of support available, but will I be able to keep up with all the appointments and therapy sessions?
I completely understand your concerns Mihiraa. It can seem like a lot to manage at first, but let me reassure you, that you won't be doing this alone. The therapists working with you, whether it's the occupational therapist, the speech therapist, or the community nurse, will not only help you directly, but they'll also work closely with your family or caregivers to make sure that everyone understands your care plan. Each part of your recovery will be personalized to suit your specific needs. Together, you'll develop a care plan that is realistic and fits your lifestyle. If at any point something feels too much or if you have any difficulties, adjustments can be made. There will be regular follow-up appointments to check in on how you're progressing, and you can discuss any concerns you have during those times. This way, we'll be able to make sure everything is going at a pace that's comfortable for you. On top of that, there are plenty of other resources available to give you extra support. We can provide written materials to help guide you through your exercises or medications. There are also support groups, both in person and online, where you can meet others who have gone through similar experiences. It can be really helpful to share your thoughts and listen to how others have managed their recovery. So don't worry too much about trying to handle everything all at once. The team is here for you, and will make sure you're well supported, every step of the way.
That's really reassuring. What about follow-up appointments and my medication? I know I'll need to continue taking it.
I'm really glad to hear that you're feeling reassured, Mihiraa. Let's talk about the follow-up appointments and your medication because those are both key parts of your recovery. After you're discharged, your doctor will sit down with you to go over the schedule for your follow-up appointments. Some of these might take place here at the hospital, while others could be done through home care services, depending on what's most convenient for you. These regular appointments will help us monitor how you're doing and make any necessary adjustments to your care plan as you continue to recover. As for your medication, it's really important that you take it exactly as prescribed. I know it can be easy to forget sometimes, but taking your medication regularly helps prevent complications and supports your overall recovery. If you miss doses, it could slow down your progress or lead to other health issues, and we want to avoid that. The rehabilitation sessions are also key to your recovery. Whether it's occupational therapy, speech therapy, or physical therapy, attending these regularly will help you regain strength and independence. I know it may seem like a lot, but each session brings you one step closer to your recovery goals. By combining your medications with the therapies, you'll be giving yourself the best chance at a smooth and effective recovery. We're all here to support you, Mihiraa. Just take it one step at a time, and don't hesitate to reach out if you need help.
I feel a lot better knowing that. Thank you for explaining everything so clearly.
You're very welcome, Mihiraa. Take care.